I want you to think about this morning. You woke up, walked to the kitchen, pressed a small pill out of its foil packet, swallowed it with a sip of water, and moved on with your day. No hesitation, no second thought, just routine. Now let me ask you something that might be uncomfortable. Do you actually know what that pill is doing inside your body right now? Not the name, not the color. I mean the mechanism, the way it changes how your blood vessels behave, how your kidneys respond, what it does when your body is dehydrated, stressed, or paired with something as ordinary as ibuprofen from the drugstore shelf. If that question gives you pause, you are not alone, and you are not careless. You simply were never properly told. Most pharmacy bags contain a folded insert the size of a newspaper that nobody reads. Most clinic appointments move too fast for this conversation. Today, I am going to tell you what nobody has had time to tell you about 3 of the most commonly prescribed blood pressure medications in the world: Amlodipine, Losartan, and Lisinopril. My name is Dr. Williams James. I have practiced cardiovascular and geriatric medicine for 25 years, and I have seen firsthand what happens when patients take powerful medications on autopilot without understanding them. I have also seen what happens when they do understand them. The difference in outcomes is not small. Today I am giving you that understanding. According to the Centers for Disease Control and Prevention, nearly half of all American adults have high blood pressure, and the majority of those over 60 are managing it with medication. Amlodipine, Losartan, and Lisinopril are among the most frequently prescribed drugs on Earth. Yet clinical research consistently shows that medication side effects are among the leading reasons older adults quietly stop taking their prescriptions without telling their doctors, causing blood pressure to climb back silently while everyone assumes the treatment is still working. The problem is not the medications themselves. These are genuinely effective, life-protecting drugs. The problem is the gap between what patients are given and what they actually understand. Here is the first thing I need you to understand, because most people do not know this. These 3 medications are not the same type of drug. They all lower blood pressure, but they do it through completely different mechanisms, which means they carry completely different side effects and completely different risks. Think of your cardiovascular system like a city water network. High blood pressure is like water pressure in the pipes being consistently too high. These 3 drugs each solve that problem by working on a different part of the system. Amlodipine works on the pipe walls themselves, relaxing them so they widen. Lisinopril blocks the chemical signal that tells the pipes to tighten. Losartan blocks the receptor that receives that same signal. Same goal, 3 different approaches, 3 different sets of consequences to understand. Let us start with amlodipine and the side effect that sends thousands of older adults searching for heart failure symptoms at 2 in the morning. Amlodipine is a calcium channel blocker. It relaxes the smooth muscle in your arterial walls beautifully. The problem is that it relaxes arteries more effectively than veins. Blood flows into your lower legs generously, but the veins responsible for returning that blood upward do not dilate equally. The result is a pressure imbalance. Fluid gets pushed out of the small blood vessels and into the surrounding tissue. By late afternoon, your ankles are swollen, your socks leave deep marks on your skin, and your legs feel dense and heavy. A patient named Douglas came to see me at 74, convinced he was developing heart failure. He had been on amlodipine for 4 months and had spent those 4 months quietly reducing his activity, avoiding stairs, cutting his evening walks in half. He was frightened and exhausted when I explained what was actually happening, that his medication was working perhaps a little too effectively in one direction, and that this was a known, manageable response. The relief on his face was visible. We adjusted his approach. He elevated his legs during rest periods, modified his dosing schedule, and within weeks, Douglas was back to his evening walks. The critical message here is this: leg swelling on amlodipine is not something to silently endure or to treat by drinking less water. Reducing fluids on this medication can create separate and serious problems. Report the swelling to your doctor. There are almost always options. Now let us talk about Lisinopril and the cough that nobody connects to their medication until months have passed. Lisinopril is an ACE inhibitor. It works by blocking an enzyme called ACE, which normally causes blood vessels to constrict. Block the enzyme, the vessels stay relaxed, pressure drops. Effective and widely trusted. But ACE also breaks down a compound called bradykinin in the lungs. When you block ACE, bradykinin accumulates, and in a significant number of patients it irritates the airways, producing a dry, persistent, scratching cough that responds to absolutely nothing in your medicine cabinet. No lozenge, no antihistamine, no cough syrup. Because it is not a respiratory illness. It is a chemical response to your medication. A patient named Constance, 71 years old, spent 9 months being investigated for allergies, acid reflux, and a possible lung condition. She had chest x-rays, allergy panels, and a sleep study. Every test came back unremarkable. Her sleep was shattered every night from coughing. Her mornings began with exhaustion before the day had even started. When I reviewed her medication history and matched the timeline, the cough had begun approximately 6 weeks after starting Lisinopril. We worked with her primary physician to transition her to Losartan, which operates on a similar pathway but does not trigger this cough. Within 3 weeks, Constance slept through the night for the first time in nearly a year. But I must draw a firm line here. There is one symptom associated with Lisinopril that is not a nuisance to manage. It is a medical emergency. If you notice swelling of your lips, tongue, throat, or face while taking Lisinopril or any ACE inhibitor, call emergency services immediately. This is called angioedema, and it can compromise your airway faster than most people anticipate. A persistent dry cough is something to discuss at your next appointment. Swelling of the throat is something to act on right now. Now let us discuss Losartan, and a danger that comes not from carelessness but from genuinely trying to do the right thing. Losartan belongs to a class called ARBs, angiotensin receptor blockers. One known effect of this medication is that it can raise potassium levels in the blood. For most patients, this stays within a safe range. But add one common, well-intentioned habit, and the balance shifts. Salt substitutes. When older adults are advised to reduce sodium, many reach for products labeled heart-healthy or low sodium at the grocery store. What many do not realize is that most salt substitutes replace sodium with potassium chloride. So a patient already experiencing elevated potassium from their Losartan is now adding significant additional potassium to every meal, believing they are protecting their heart. Elevated potassium does not always announce itself dramatically. It can arrive as unusual muscle fatigue, leg cramping, a strange tingling in the hands, or a fluttering sensation in the chest. Sometimes there are almost no warning signs at all until there are very serious ones, including dangerous disruptions to the heart's electrical rhythm. If you use a salt substitute and take Losartan or Lisinopril, that combination needs a direct conversation with your doctor at your next visit. If this kind of honest, detailed health information is what you have been looking for, subscribe to this channel right now. My entire purpose here is to give you the clarity that a 10-minute clinic appointment simply cannot. Subscribe and stay with me. A patient named Walter came to see me at 77. He was a meticulous man, a former accountant who tracked everything. He had been managing his blood pressure for 6 years and considered himself a disciplined, informed patient. What Walter did not know was that his habit of taking ibuprofen every morning for his arthritic knees was quietly working against his Lisinopril in a way that was placing genuine strain on his kidneys. Over-the-counter anti-inflammatory medications reduce blood flow to the kidneys. Combined with an ACE inhibitor and even mild dehydration on a warm afternoon, that reduction becomes meaningful and potentially dangerous. Walter's kidney function had been declining gradually for 18 months. Nobody had connected the dots because nobody had asked the right question, and Walter had never thought to mention the ibuprofen because it came from a drugstore shelf, not a prescription pad. We transitioned him to acetaminophen for pain management under his doctor's guidance and reviewed his hydration habits. His kidney markers stabilized over the following months. Walter told me afterward, "I thought I was being responsible. I just did not know what I did not know." That is exactly why this conversation matters. Here is your practical framework starting today. If you take amlodipine, pay attention to ankle and leg swelling, particularly in the late afternoon. Report it to your doctor rather than reducing your fluid intake or silently cutting back on activity. If you take Lisinopril, note when any persistent dry cough began relative to when you started the medication. If they align, that connection deserves a conversation with your prescriber. And remember that throat or tongue swelling is never something to wait on. If you take Losartan, check the label of any salt substitute you use and discuss potassium-containing products with your doctor, including electrolyte drinks and certain supplement powders. Ask your doctor specifically, what should I do with my blood pressure medication if I become ill and cannot eat or drink normally for a day or two? Write the answer down. Illness changes how these medications behave inside your body, and having a clear plan before you need it is one of the most protective things you can.
Finally, if you regularly use ibuprofen or naproxen for joint or back pain, and you take any of these 3 medications, raise that combination at your very next appointment. There are usually safer alternatives that protect your kidneys and still address your pain. These medications are not your enemy. Taken correctly, with awareness and proper monitoring, amlodipine, losartan, and lisinopril protect hearts, prevent strokes, and extend lives every single day. But they deserve your understanding. They deserve your attention. And when they produce symptoms that feel wrong, they deserve your voice. Silence is not compliance. Quietly enduring a side effect that makes you dread your morning pill is not strength. It is the beginning of the day you stop taking it without telling anyone. And that is when blood pressure rises and everyone is caught off guard. You are your own best advocate, and now you are a more informed one. I want to ask you one question in the comments below. Which of these 3 medications are you currently taking? And did anything you heard today surprise you? Tell me. Your answer helps me understand what this community needs to hear next. Please share this video with someone you love who takes blood pressure medication. They may be experiencing something they do not have the words to describe yet. This video might give them those words. Subscribe and stay close. Next time we are going to talk about the specific foods and drinks that interact silently with blood pressure medications in ways that most patients are never warned about. Your health is worth understanding fully, not just managing, understanding. Everything I have shared today is general medical information based on research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider before making changes to your medication, diet, supplements, or health routine. Never stop or adjust a prescribed medication without first speaking with your doctor.